here we are. We're coming to you today with the goal being, let's share something about how we view wellness. I think all of us would agree that wellness is more than the simple absence of disease. I think we would agree that we can't define wellness by simply looking at disease biomarkers or disease risk factors. You're not well up until the morning when you have your heart attack. You don't just wake up in the morning, have a heart attack, and suddenly have coronary artery disease. Something else has been going on for a long time that maybe you just haven't looked at. And wellness is more than even exploring that preclinical phase. Wellness is really about the pursuit of doing what you want to do. It's not a destination. It's not a destination that any of the people on this telephone call can define for you. It's not a destination that anyone writing a book can define for you. They can put some benchmarks, they can put some flags on top of a few hills that they say you may want to get to. They may warn you about valleys, and some of those valleys may be almost a blessing to walk down into, but they can't chart your path. And ultimately, it's up to you. And it's about the journey, because once we get to where we're going, we have more places to go. And I think most of us would agree with that. One of the really tough pieces about, kind of this wellness path is in allopathic medicine, which as a practitioner, I think I'm feeling more and more betrayed by, or maybe I'm recognizing that my patients are more and more betrayed by as I see them come into the office and see the care they're getting elsewhere. It has to be about an integration of something more than just the biological or the physical that we see on the surface. It has to be an integration of the mind, the body, and the spirit. It has to be a way of being the whole person. And I think that's achievable if we redefine what we mean by wellness. Wellness, as I said, not the simple absence of disease. It's not meeting the criteria that any of us could give you about what wellness is. Wellness is being able to do the things that you want to do. Doing the things you want to do is a function. Being clear about where you want to be in the world and what it is that you want to do should kind of define that. Functional for me today will be doing some rowing. Functional for Michael may be getting out and working on the farm, or as he did yesterday, taking a long walk on the new path that they've created. Functional for Courtney may be about taking a hike in the woods. None of those things are about what a practitioner could define for you. And function has many different pieces, and we've been thinking a lot about this. Michael and I are involved in a big project called Lifehouse, which stands for Lifestyle Intervention, Functional Evaluation, a Health Outcome Survey. And for those of you who know Jeff Bland, you probably recognize that that title came out of Jeff's mouth for the first time. It is a project to define health by measuring it by function. And we've settled upon 5 functions. There's the kind of physiologic or metabolic. It's kind of looking at things that we can't see with the naked eye, kind of the micro view. There's the physical, which is looking at the bodies and how we move and how we feel and the way we walk. There's the cognitive, how we think. There's the emotional, how we feel, what we believe, that blends into the cognitive. And all of those things, we thought those were going to be the first 4 functions. But there was something missing. And the missing part of that was behavior. Because behavior is how we show up. Behavior is the reflection of that inward integration of all those other pieces. You know, when I do something, my biochemistry is firing off, my mitochondria are making energies, my DNA is replicating, hormones are moving around, telling me what to do, nerve messages are being sent, then my muscles move. Just to move my arms, which you couldn't see, my muscles move just then. To talk, you know, I'm wrapping in my brain, I'm wrapping in how I feel. All of this is reflected to you as behavior. You know, the definition of a sacrament is the outward expression of an inward grace. I like to think about function as that outward expression of our inward integration of our mind, our body, of our spirit, of the micro, of the macro, of the cognitive and the emotional. So what we want to do with our work is help people define who they are and where they want to be. You know, one of the big problems, I think, in the dissonance that we feel about wellness is we really don't know which functions it is that we want to hold. Years ago, I went to the Center for Mind-Body Medicine's Jim Gordon's cancer care conference, and this goes back to the early 2000s. And he put on a conference that was unique because it wasn't just for practitioners. It wasn't just for patients. It wasn't just for policymakers. It was for everybody to have a conversation about what cancer care should be. And people were talking about cancer as a gift. They were talking about their diagnosis as a gift because it was, for some of them, a slap in the face. It was an awakening. It was a jump start into asking the question of, what do I want to do with perhaps a defined amount of time that's left to me? You know, what do I want for my life? You know, did I want to write the great American novel? And I think for many of us, that kind of personal touchstone of knowing what we want has been lost. We've lost it somewhere along the way as we bounce forward into our lives. You know, when we were kids, maybe we wanted to be an astronaut, maybe we wanted to be a ballerina, maybe we wanted to be a paleontologist, maybe we wanted to be, you know, a soldier, maybe we wanted to be a sports star, a rock star, maybe we wanted to be the president of the United States. We had dreams, and all of those dreams kind of fit with the journey that, you know, Joseph Campbell talks about, the hero's journey. You know, we all saw ourselves making a difference in the world. We all saw ourselves contributing. And the interesting thing is that none of us, you know, as little 4-year-olds, none of us probably ever thought, I want to be in the 5th cubicle back, 4th row over, and I don't want anyone to know my name. But I believe that a lot of our education, a lot of our socialization, a lot of our acculturation, leads us to be in a place where we become smaller and smaller and smaller, and we accept it. You know, but, you know, obviously not everyone can be president of the United States, but everyone can still be on that hero's journey. Everyone can still aspire to be that leader in their communities, that voice of what we hope would be, you know, honesty and ethics. And, you know, and obviously, given our past experiences, we need some new people to step up with those voices. But that said, you know, we all wanted that, and a lot of us aren't leading it. And we've lost that touchpoint because we don't know what it is, that touchstone, that stepping off point. You know, J.R.R. Tolkien writes about, you know, the danger of taking that first step off your lawn or off your front porch, that step down into the stream that he talks about when Bilbo goes on his journey there and back again. So, you know, we take that step, we do that piece, and we start looking for who that authentic self is. And that's really part of what we really are going to offer is the Consilience partnership, blending the functional medicine model with a self-discovery model to try to say, hey, what is it that you want to do? What are the obstacles to it? How did we get here? And how did we kind of get stuck and not get here? As many of you know, if you've been following us on social media, today is intended to be a taste of what we're going to be doing at places like Feathered Pipe Ranch on July 5th, what we're going to be doing at Harmony Hill Retreat Center up in Union, Washington on the 11th of June. It's an exploration of what our hero's journey is, that kind of step as Ann Valley Fox and Sam Keene talk about in their book. It's a opportunity to reauthorize and reauthor the myth by which we all live. And we put that into the functional medicine model so that we can address those functional roadblocks, those metabolic roadblocks, those physical roadblocks, those emotional and cognitive roadblocks to get us to our goal. One of the things that Michael and I have talked about is the fact that in a lot of ways, a lot of people talk. And we didn't want this to be 90 minutes of us talking about what we think. We wanted this to be about the practicality. So when we do a program like this, and we're going to have another little program like this probably on the 15th of May in some context, and we'll have a surprise announcement at that point about Feathered Pipe for those of you who are still hanging in there waiting to decide about Feathered Pipe. But all of these, we hope, will give you a skill that you can walk away with and an opportunity to take a big step forward in terms of self-knowledge, finding that touch point, and moving forward along your own timeline, which is exactly the topic that Dr. Stone's going to take up at this point in time.
Very good. Good morning, Courtney. How are you?
Good morning. I'm good.
Thanks, Joe. I think of yourself now compared to think of yourself a year and a half ago. What are realizations about yourself now that you didn't have at the beginning of the pandemic? How have your goals and dreams and the progression of you as a person, or you, your children, your family, how they changed? Has a timeline of a friend or a loved one stopped because they passed? How has this impacted you? I found myself wanting to, pausing and asking myself that question. There's nothing about this last year and a half in the United States, and now even more aggressively in the world, that doesn't, if we allow ourselves to pause and consider, make us think about our timeline. What is your timeline? Well, in the Consilience partnership, I think part of this journey and discovery is maybe even taking just a blank piece of paper and drawing a line and putting you next to the arrow, yourself next to the arrow, and think about your timeline in the past, how it's influenced you, and your timeline into the future. So, next slide, Joe. This was supposed to be animated, so I'll talk you through the animation. When we think of ourselves, our timeline on the far right, the yellow line, now that's where you are today. But start considering the important influences, your last important influence, the last time you felt well, the last time you felt success. Think of the time that's led up to today and start identifying different landmarks in your past as far back as you can remember. And I would posit that many of the different aspects of our timeline go way back to early childhood. Actually, what we realize now is to our health trajectory may have been influenced by what happened while we were in the womb. When we start thinking of timelines through the functional medicine lens, we think about antecedents. Antecedents are the genetics, the things that led up to, the things that set the stage. Well, there are some great influences that set your stage, and that's the experiences of your mother and father, the genetics of your mother and father, and the experience of your mother when you were in the womb. Isn't it interesting that environment in the womb that washes over our genes actually indeed helps set the stage for our health trajectory through time? That gets a little heady, doesn't it? Are you kidding me? I'm 60 years old. Are you saying that my cognition, my considerations in dementia or in heart disease were influenced by what happened during the womb, or by my life in the womb? And I will say, yes, indeed. The data is showing that. But the great thing is our genes, our physiology, our function is plastic and it can be adjusted. So we all have antecedents, genes, okay? We all have mediators, things that wash over us. That can be as simple as education. It can be the food we eat. It can be how much we sleep. It can be how much we move, our lifestyle choices that perpetuate the function or the dysfunction. And then, so antecedents, triggers, and mediators. Mediators are things that continue to drive the process. So let's make it real. If you were to take a piece of paper and much like, go ahead and go to the next slide, Joe. Much like the piece of paper, and you draw an arrow, and that is you today on the far right. What were the influences for your well-being through your life? Did you grow up and have a great diet, and then your diet changed, and then your diet improved? Through your childhood, did you encourage exercise? Did you stop exercise? Did you bring it back? Have you exercised well throughout your life? Let's put in your dream timeline. When you were very young, what was your dream? When you hit your teenage years, did your dreams change? Where are you in adulthood or middle-aged or later? How have your dreams changed? Have those dreams, has your exercise, has your diet, has your physical condition, has your function changed? Is it where you want it to be? Part of looking at yourself on a timeline, and this is an example of the functional medicine timeline that we use in Institute for Functional Medicine, is to help see patterns with time. And with those patterns and those changes, then you can be very intuitive, but very precise in how you can begin to bring more health and well-being by correcting imbalances or improving patterns from your past. So, Joe, how have you used timelines in your day, in your practice?
To a greater and lesser extent. At Feathered Pipe, and in settings where we have more time, we actually get people to fill these out, write them out, and share them. My current software system doesn't allow me to build a timeline, so I'm not doing it there. When I get real puzzled, I will do a timeline outside of the patient visit and try to see that I've got the story right. And sometimes, not as often as I would like, because again, we're practicing functional medicine in an insurance-based model. I try to tell the story back, particularly when it's a complex story, to demonstrate that I heard it. And when I do that, I've organized it along a timeline in my head. And certainly when I try to explain what I think causes things to happen at a distance, like why your thyroid may be related to your gut, I try to put it in this description. And I have kind of a silly description of a camping trip to explain the antecedents, triggers, and mediators model, which I frequently use.
Yeah, that's great. For me, I think we're all used to timelines because all of our stories have a timeline, don't they? All the legends have a timeline. All of our, even telling the stories about children, or if I'm telling a story, it has a timeline. Courtney, you use timelines all the time, maybe not drawn out, but maybe drawn out in the work you do with the counseling.
Oh yeah, absolutely. I mean, like that's one of the first things we do is construct a timeline together. And that kind of gives us an idea of, you know, what were the main events that occurred in life that were so salient for like my clients to remember. You know, it's all of these events that have happened are typically super emotionally charged and always influence how the individual perceives their current circumstances. So yeah, super important.
That's perfect. And the timeline, when we start thinking timeline, I often have folks, if they're struggling with weight, I have them draw a timeline of their weight, draw a timeline of their movement through life. Often, it was so long ago, I'm not even sure if it's a memory, but when I did triathlons, there was a definite timeline to training. And then there was a timeline if you got injured to how you came back and tried to restore function. I think there's timelines when it comes to families. There are timelines when it comes to all aspects of our life. And sometimes we lose track of those timelines. We each have a timeline of what's happened during this pandemic. How has it influenced work? How has it influenced economics? How has it influenced your dreams? So sometimes it's just important, and I find it very important, to just sit quietly with yourself, draw out the timeline of how things changed, or then projecting it into the future. How would you like this timeline to extend? Joe, is there any other aspects that you want to bring forward here?
Bring myself back into the stream. I actually think that was very nice, Michael. I think one of the things that we've talked about, and I'm trying to get rid of, bear with me for a second, everyone. I'm trying to get rid of the PowerPoints on my end, and they are stuck in front of me.
Do you have that? If you want to work on that, I can fill your list.
Okay. I got it. So, you know, I think one of the things that really, you know, strikes me, and I think you're going to talk a little bit about this, is that the timeline fits right into those discussions about the changes that we need to make. I mean, sometimes it's the timeline for understanding disease, and the movement forward, understanding family models, and we're going to do the genogram with Susan in just a few minutes. But it's also sometimes the timeline is great for removing tacks. I think you really share with us some of the tack rules.
Yes, indeed. So one of the great visuals that Sidney Baker spoke, one of the fathers of functional medicine, talked about is if consider the tacks. If you're sitting on 3 tacks, you can take a lot of medication to try to take the pain away. You can work to remove one of the tacks, but you may not necessarily feel 33% better. You have to really look at how you can remove some of the pain or imbalance instigators to allow you to move forward. And it may be a simple, one of the tacks to remove is lack of sleep. We all know how sleep influences all of physiologic function, our ability to think, and how quickly we age. So assessing sleep. Another one is, one of the tacks may be the nutrition choices that have become habits. It may be the amount of stimulants you drink, as in caffeine, that influences many different aspects of your physiology and your diet. It may be diet choices that are more comfort foods that are fine to a point, but in your setting, your nutritional choices may be a tack. It may be toxic relationships, relationships with others, relationships with work. That may be a tack. Or it may be stress for you, how you responded. Are you a how do you respond to really stressful situations, how that's driving your cortisol and many aspects of that. That can be a tack. How has the pandemic affected all those 5 areas of function? What has it revealed about itself with you? So the tack rule is, if you're sitting on 3 tacks, remove them as best you can. And if you just take extra medication, that pain is not going to go away. How did I do for the tack rule, Joe?
Pretty good. I think one of the tack rules is, if you're sitting on 2 tacks and you take one away, you're not going to be 50% better.
That's right.
And then the other one, it takes an awful lot of aspirin to make it feel better when you're sitting on a tack. So
yeah,
kind of the more direct clarification of that. And I think that really is one of the underlying principles, right, of what functional medicine is. It's what do I need to add? What do I need to remove? And what we're talking about adding is a deeper understanding of who we are to this model. And Susan actually has an exercise called the genogram, which she's going to lead us through. And I'm going to see if I can share this effectively at this point in time. Make this a little bigger, say share, hit play. I need to actually show it. Now hit play. And we're going to listen to Susan for a few minutes as she does this.
I am so excited to share with you set the frame for the activity with you today in this small little bite-sized look at what a genogram is, and then invite you to take your time to really explore this tool and build upon the awareness and reflection that can come from an activity like this. So I'm going to go ahead and share my screen, and we'll walk through the genogram activity and see what we can learn together. Share this screen. Great, wonderful. So yes, very much a process of self-awareness. And wherever we have that opportunity to build self-awareness, it gives us more choice. It gives us more agency in being able to recognize what we see and what we identify. We then have choice in looking at how we will pursue and okay, so by definition, there you go, you can read, right? It's really a visual representation looking at a different way to look at our family tree. So I don't know if any of you remember the days of transparencies. To me, this activity is very much, and that, you know, that kind of the hot screen where you layer on a piece of plastic and draw on, and it projects up onto the wall, and you add another layer and draw on that. This process is very much like piece, and then what other pieces of information we can layer on top. And one of the opportunities, some of the opportunities outlined here, is to help us see deepening our awareness, certainly, but maybe we can see some new patterns that we weren't aware of, or different aspects of relationship and connection that may have influenced us in ways that we hadn't thought about before. So when it's time for you to create your own, you will definitely need I would say several pieces of paper. I don't know about you, but perfection isn't the goal here. It's practice and iteration. So give yourself some practice, extra pieces of paper, pencils, colored pencils, and certainly an eraser so you can make corrections along the way. There are also ways online that you can populate a genogram, so don't feel like you have to do it by hand. I think it can be part of a therapeutic process to draw it out on your own. Again, with that, the lens of self-acceptance, perfection not being the goal. This isn't a time to critique yourself as an artist. This is an exploration. So these are things that a genogram can consist of. It can consist of names and ages of all family members, kind of 3 generational levels. Life events, you know, what happened in those lives. Noting those for the people represented. And then some of the nuanced pieces we could look at: connections emotionally, where did we live, did we move a lot? What were some of maybe our shared passions, maybe some shared health journeys, different kinds of aspects that influence our family system. So the big gray Lego block, the base one, right, that we start from in the first transparency and the layering process. We would look at the relationship with grandparents. So we have here men represented by a square and women represented by a circle, traditionally, or symbols used in a genogram. And we recognize that these 2 people in a relationship that bore 3 children, and then we look at what happened from those offspring and their offspring, and so on and so on. And where do you fit in that family tree? That might take a little bit of time just to recollect and reflect. Depending on how large or small your family is, you may need a larger piece of paper. Relationship symbols. So we can look at the traditional marriage, or we can look at the relationship. Were they separated, legally separated, divorced, or perhaps we can get creative here. Traditional legal terms. And then in addition, we have symbols that help express who else was in the family. Were there pets maybe that you wanted to track that were significant in a family story? Maybe you had a child that was somewhere in the family adopted, fostered. How many pregnancies were there? Maybe if you know miscarriages or abortions, deaths. This is how twins are expressed, and this is how identity is expressed. And then there's always this space to honor how people choose to identify themselves. So please make sure to make space for that in your expression of your family history. So this is an example of the layers when we add in dates of birth and death assistance for the oldest generation and how long they live. These individuals were married and then divorced, and then their children and their children. Also a child here, it looks like lots of different relationships that you can represent through these particular symbols. And then in a second layer, we want to consider what are some of those patterns and trends related to health conditions? Do we have, this kind of like the questions that you get asked when you go in a doctor's office, what was your family health history? And you can go as deep here as you want to. It's interesting to notice paths and patterns, both from both sides of the family and as far in as you want to look, or you have capacity to look. I know all of us don't necessarily have access to going back, or maybe people we can ask going back generations. If you certainly will provide to you these slides after our experience today, and all of these are very publicly available. But these are different ways that you can look at maybe behavior. Did we have some risk of health behavior, smoking, alcoholism, maybe substance abuse? Something else related to Alzheimer's, or maybe you have a history of heart disease or cancer or obesity. These are just some examples. Certainly you can get creative here and express those trends and patterns that stand out for you in your recollection related to your family history. And another layer we might want to consider relationships expressed by kind of how would you define it? And this is a very simple. You perceive other people's relationships, you could say there was like distance, maybe there was an abusive relationship. Noting it and recognizing closeness or disconnection, just and understanding as well. There are a lot of skills that we get back from our families through both positive experiences and adversity. So it's good to note the patterns. And in these next couple of slides, I'm going to share with you some things that you can consider if you want to check in with other family members to ask the actual information. What really did happen in the last two generations? So is there awareness related to hospitalizations, physical or emotional? You would want to note, again, from a place of observation, trying to take yourself up a few thousand feet and be an observer in this, so that when you're done painting your picture, you have some ability to step back. I picture this activity almost like looking at a pointillism art piece. When you get really close, all you can see are the dots, but when you step back, you see this full picture and maybe some things that you haven't seen before. So example questions for relationship. Who are you most like in your family? Or who do people in your family say you're most like? Who are you closest to? Maybe your naming story. Relationships in the family for yourself. Who are you distant, close, conflicted? What are those for you? Patterns we hold each other in relationship. And then strengths. I mentioned a few minutes ago that we have strengths that we receive from our family, whether that's from a positive role modeled experience or maybe some adversity. Yeah, what are 3 strengths? What one person in your family is important to you? Maybe they're all important to you, but sometimes when you ask the question, who's the first person? That's the attribute of an individual. What's one person in your life who's been important to you? Maybe not in your family. Noticing that, leaning toward the attribute about that individual that is important. Is that or is that not connected to your family story? I'm lastly looking at our value system, and our value system comes from many places beyond our family, and it's important to consider what's the messaging that happens throughout our family system about being ill, about expectation for what we do with our time, for money, career, employment. What about the message related to religion, faith, spirituality? What about the role models, the roles of women and the roles of men? Certainly we could also consider role models. So all of these things are for you to consider as you begin to build for yourself your genogram, and that picture and those little tiny points of paint and ink and colored marker that you can then step back and look at reflectively to see if anything stands out for you in terms of pattern, and then looking at the generation beyond yourself. And what are those messages that are cascading down through family beyond you? So I appreciate you taking the time to consider this activity, to consider how this can contribute to you, and how that process of building your own self-awareness. And we really hope that this helps continue to amplify your lived experience, your health, your wisdom, and your purpose. Have a wonderful day. Thanks so much for spending time.
Well, thank you, Susan. You know, it's exciting to have had Susan do that. Unfortunately, she just wasn't able to be with us today for doing it. Michael, I'm bringing you back online. You have some further comments about how this ties in with the timeline discussion and what we're going to be doing at Feathered Pipe. And at Feathered Pipe Inn at Harmony Hill, we'll be bringing you colored pencils, by the way, and we'll be bringing you a journal, and we'll be bringing you all the tools you need to do these pieces. So, Michael, it's all yours.
Yeah, absolutely. And if you could pull up my second slide, that would be great, Joe. I think, wasn't that great? I mean, it just takes, the timeline may be a beginning spot for you. Asking all those questions around the your genogram, answering the different questions about the influences of money, family, perspective. It just almost, your timeline becomes almost a hologram that actually goes back into the generational influences, doesn't it? So I think one aspect when you think of your timeline, it's easy to think of our story, our career story, our education story, our financial story, our family story, but recognize those influences. Think about your life and the influences on your health, on your well-being, on your dreams that may have been influenced by things in your childhood. And depending on when you start filling out the genogram, you'll see that those influences may have affected the influences on your parents, but then affected the influences on you. How do you parse those out? How do we begin to tease those out so that we can gain the perspective, of well-being? How do we change our journey? From where you are now, the influences back to when you were born, the influences of your parents, the influences of all the different aspects of your life that have led to this point. If you have 100% great function in those areas of function that Dr. Lamb talked about, physiologic, physical, emotional, cognitive, and behavior, that's great. Then you have a perfect starting point to catapult yourself into the future. If there are hiccups in any of those areas of function, then what are those influences from your past, from your family, from the habits of family or yourself that can help improve your function if you come up with a path on how to improve that. And so I think together between the timeline exercise, the genogram exercise, putting in perspective of those modified lifestyle choices and the just one thing that you can choose to do to improve your journey, then that's a robust place to start. And then I'm excited to hear the next portion of our presentation today.
Thank you, Michael. Thank you, Susan. So, one of the parts that becomes really interesting to this discussion is recognizing the emotional, recognizing what has taken place in our life along the way, recognizing the kind of journey and those points that both Susan and Michael were talking about, like how did emotions get handled in our life? How have they shown up for us? Have they been helpful? Have they not been? What do we know about ourselves? What sort of stories do we tell out of our emotions? And most of us feel that emotions happen to us, as opposed to having a conscious relationship. And that's one of the things that we really want to build on is consciousness, making aware choices, making mindful choices, making choices that are going to lead us to better take that next step in a direction that we want to take. Courtney does an awful lot of work about the meaning of the stories that her clients tell themselves, the meaning of the stories that they've been told, and trying to help them explore. So she's going to lead us on a little bit of this journey right at the moment as we go forward in the next part of our session.
Thanks, Joe. So as we learned from Joe, we have this whole integration that we're dealing with our mind, our body, and spirit, right? And as we learned from Michael, our timeline comes with our antecedents and our mediators. And Susan just taught us about generational patterns. And this all kind of leads to like these behavioral epigenetics that we kind of like shape the way that we interpret the world around us, as well as how we, continue to pass that along as we go on. How do our children learn how to express themselves or communicate? That's all learned in the home. So I want to sound really smart, so I'm going to start this with a quote, right? There's actually a Native American proverb that says, "The one who sells a story rules the world." And I really love that quote because it reminds us that we have a lot more control over our lives than we think we do. A lot of times when I get clients coming in, they're generally telling me about usually they come in with their own diagnosis. And they'll usually tell me about how this and this and this happened to them. And, we end up usually constructing some sort of trauma narrative. But I always warn clients when I first talk to them that the hardest part of going through like trauma work is not like having to face that or the emotions or remembering everything that you went through, but rather it's constructing an identity outside of that trauma afterward, right? We're no longer using that trauma as part of our identity. Now, I'm going to throw a lot of information at you in a very short amount of time. So forgive me if I hasten my pace a little bit. Our stories kind of transform our lives. They give us certain biases, perspectives, lenses in which to interpret the world around us, right? We get some sort of, like at the skeletal level, and we get some sort of input. We assimilate or, I totally forgot the word for it, but we assimilate that information and then we provide an output. That's our behavior, right? And this ties into our emotions, because it's part of what helps create that piece in which we interpret things. We generally classify our emotions as either good or bad, which is always interesting to me, right? So a lot of the bad emotions that we might talk about, we might say anger, sadness, anxiety, fear, that sort of thing. And a lot of the good feelings that we generally postulate as happiness, excited, love, euphoria, I guess. But the truth is that none of our emotions are inherently good or bad, right? They're technically all good because they all ignite different physiological responses in us, you know, as Joe was saying earlier. And some help us implore hormonal changes, activate certain neurochemicals, and or prepare the body for our next actions, right? And I think people kind of forget about that, like how important those emotions are. Like anybody who like is on my Facebook or social media knows that I'm not about normalizing mental health per se, but rather normalizing human emotions and responses, because I think we've almost forgotten that, you know, experiencing emotions is normal. And obviously, like, they're all good responses. Otherwise, we wouldn't be able to survive. And they also provide us with contrast, right? The whole yin and yang thing. We can't really acknowledge the good without experiencing some of the bad. And I think it makes us not only more appreciative, but allows us a further depth in what we experience. Or they can be used as like learning experiences. Maybe I shouldn't do that again. Or maybe I'm going to repeat it like 4 or 5 times before I actually learn the lesson that I should. Everything that we take from the external world is processed through a lens that's influenced by our emotions. You know, that's where it's assimilated and synthesized to produce, again, that output that we have, our actions, our behaviors. And the accumulation of this process coming or happening over and over and over is what develops our narrative, how we view ourselves and how we interpret all that information. You know, I think one of the best ways to kind of explain this is probably like, you know, when we go into the gym, right? We generally go in there and we have this notion of health and wellness and, you know, a habit and discipline. These are all words that come pretty naturally to us when we're like thinking about the gym, right? But we don't think of things like orthorexia, you know, this notion of, you know, eating almost too healthily, or we don't think about the people that are out in there working out for like 5 hours at a time, or, you know, these things that are inherently just as unhealthy as not ever going to the gym or not ever participating in any sort of physical wellness. But it's not the lens that we look at the gym through is what's been, you know, hammered into us over and over. So my question for you is, what does your story do for you? How do you see yourself? And how is that influencing your output? How is that influencing your behavior? Does it hinder you? Does it motivate you? And I'm not asking you to change who you are. Honestly, like, we look at behavioral change as really difficult. It's not. It comes really easily once you know what you're doing. So instead, I want you guys to think about finding a purpose in everything that you're doing. You know, even the bad. I don't. I think there's this what is it, like a phrase going around about toxic positivity, And I'm always trying to be wary of that because I know it's something that really upsets the teens that I work with. So I'll never say find a silver lining in your situation, because it's absolutely okay to be upset or pissed off or sad about what you're going through. But I will say try to find a purpose for it, you know? What are we learning from it? What are we gaining from it? And if there's nothing that we're gaining, maybe it's just that contrast for us, you know? Maybe it's just, you know, this was a really crappy day and it just reminded me of all the other good days that I have. And it reminded me that, sweet Jesus, like tomorrow's going to be significantly better than it was today, you know? Um, so I just want you guys to transform that narrative into a purpose. All right. Um, I'm going to go ahead and lead you guys through a guided imagery experience. So for this, I want you guys to just kind of remember that we've used imagery since we were little, right? Like we all had imaginations, one would hope, and we're just kind of trying to bring that back in. We can intensify this by using as many senses as possible in guided imagery. And it's all up to you guys on personal creativity. Everyone has their own order or preference for sensory experience. So some of us see, some of us hear, some of us smell. And I want you to think about the sounds, the images, any feelings or touch that you get, smell, even taste, if that's what comes to you. So all you have to really do now is just kind of listen to my voice and listen to your heart. If at any time the suggestions don't fit for you, that's okay. Just go with what you feel is right. Trust your own experience. Remember that we're not resisting any thoughts or feelings, just allowing them to exist. Okay? All right, so get in a comfortable position. I'm gonna be actually reading a script, so just my eyes will not be closed for this. Go ahead and allow your eyes to close if you're comfortable doing so, or lower your gaze to the ground. Begin to focus on your breathing. It can help to imagine inhaling a certain color and exhaling another color. Inhale red, exhale green. As you breathe in, think about your diaphragm expanding, your stomach rising, making sure that breath is going all the way down. As you breathe out, diaphragms contracting, stomachs falling. In through the nose and out through the mouth. Allow yourself to relax and to imagine visiting a comfortable and safe meadow. Perhaps it's connected with a safe place you have traveled to before, or maybe it's a new destination. Maybe there are flowers. You may notice the grass under your feet. Think about how it feels. Surrounding this pleasant meadow is a ring of trees bordering the outskirts. Notice the clouds in the sky and the birds passing through. Perhaps you can hear the hum of cicadas or the chirping of meadow birds. Allow yourself to journey to the edge of the meadow and choose a tree that is familiar to you. I want you to really think about what this tree looks like. Walking up to the tree, admire its shape, its texture, its size and beauty. As you approach this tree, you may notice a large hole in the trunk and feel drawn to the whole. Inside this tree is all that is within you, your wisdom, your dreams, your intuitions, and your emotions. In a moment, you will ask one of these emotions to come out of the tree. Maybe it's joy, maybe it's fear, forgiveness or anger, guilt or sadness, anxiety, jealousy, or maybe even love. Choose an emotion and invite it to come out of the core of the tree. Try to visualize this emotion. It can take on any shape, size, or color, but just let it happen. Let it emerge. Let it exist. And as you look at this emotion, notice what it looks or feels like. It's here to talk to you, to listen to you, maybe to share some information. Begin by thanking it for being there. Thank it for doing the best that it could to protect, defend, or encourage you, to help you cope or thrive, for doing what's best at the right time. Notice these emotions create sensations in your body. Where are they occurring? What are you feeling? Could be tingling, vibrating, heaviness, warmth, cold. Continue by telling it how you feel about it. Is it overpowering? Is it not there enough? Is it helping or hurting you? Whatever you want to tell it or ask it, do so now. Then when you're done, stop, breathe, and listen. Listen to what it has to tell you. Allow yourself to be receptive to its message. Breathe, listen. Let the message, the words, the feelings bubble up. Sometimes we don't necessarily hear anything, but we might see something. Maybe we see a word. Maybe an object appears. This is it trying to communicate with you. It's time to say goodbye for now to this feeling. But as you prepare to leave, decide whether you want it to change the size or the shape of itself, and allow it to do so. Think about whether you want to put it back in the tree or leave it out in the sun, or maybe in the shade. Say goodbye in whatever way feels right to you, and begin walking back across the field. Use your awareness to come into the moment, but remember that you can always go back. You can always talk again, at any time, in any place, to your emotion. As you walk, notice how you feel. Perhaps you notice that you are feeling more energetic or relaxed. Maybe your chest feels a little bit lighter. Move as though you are striding towards your center, affirming that in your center, you have an unlimited source of energy emanating from the principle of your being. This ever-present energy is strong enough to accompany you through every portion of your life, including your troubling stories and emotions. It is channeled energy, guided toward where you encourage it to go. Carry this feeling with you for the rest of today and every day. Think of it as a gift from your higher self. Come back across the meadow to the room, regaining your awareness. Gently stretch, take a deep breath. Eventually, go ahead and open your eyes when you're ready and comfortable. And having completed this exercise, you may sense actions you might want to take in future involvement with this emotion. And I invite you to journal about your experiences with our exercises today. One of the best things that we can do for ourselves is allow those emotions to happen without judgment or bias. Joe, if you want to take it off, you can.
Thank you, Courtney. That was very powerful. You know, the experience, as you've seen, we've kind of used a functional medicine tool. We've used, kind of a mind, body, spirit wellness tool to show you what we'd be doing during our longer experiences. We are fortunate enough towards the tail end of our time with you today to have another guest, to actually have Kate Kaki, who is going to be our kind of leader in physical exercise, join us. Kate, you want to tell us a little bit about you and what you have planned for our time up at Feathered Pipe?
I'd love to. Am I
You're
on?
live. No, now you're muted. Hang on.
Now.
You should be live now.
Okay, thank you. First of all, it was really exciting, Courtney, to go through that. I enjoyed that very much. But yeah, I'm very honored to be included at the Feathered Pipe experience. I'm the half hour in the morning exercise experience. And I have been leading exercise for about 4 decades now, which is amazing, scary. It's been that long. Started off as a gym rat. And in my 20s, I worked in a busy Newport Beach emergency room as an EMT for 5 years. So I got to see the inside and the outside of the body. And I'm a massage therapist and went to culinary school. And I always circle back to the fitness industry because I love what exercise does to my body, and I can help other people feel good and look good and come together to move their bodies and be active. And I've pretty much seen all the different phases of the fitness industry, and it's been a lot of fun. And I've met Dr. Lamb when he was working at Metagenics, which is a company that my husband was CEO, and now he is my doctor at the Personalized Lifestyle Medicine Clinic, and I'm honored. So looking forward to this summer and getting past all this COVID in our world and going to this retreat.
Thank you, Kate. That's wonderful. I'm going to bring Courtney and Michael back. And we have a little bit of time. So if people have questions that they want to toss in the chat box. We'll be glad to address those. And anyone want to comment while we're waiting for questions? Courtney, Michael, anything you'd additionally like to say?
Sure. I think one of the things that, Courtney, you brought out in the visualization is something that we're really going to touch on. And that is the use of your hedonic senses. So some of the experiences we'll have at Feathered Pipe for sure, maybe at Harmony Hill, is that we're going to bring in the understanding of senses triggering memory and senses triggering restoration, how the brain heals itself, how we improve well-being by using the senses of smell, taste, hearing, vision, and touch. And it's interesting, during the pandemic, what do we notice? That many people lose their sense of smell and sense of taste if they've had the virus. And so we'll talk a little bit about how you can use different techniques to help restore those senses. And it's interesting how the brain heals itself and in well-being, not necessarily just from a COVID aspect, but depending on what injuries or things in the past or conditions that have altered nerve function, you can bring senses that tie to memories that help you restore and grow new nerves. And so we're going to bring some of these hedonic senses in. It's going to be awesome. We'll kind of flip between the left brain, science geekiness, to the right brain, experiential. What does that mean in the context of me? And I think it's going to be fun.
Well, we're certainly hoping it will be. So far,
it will be fun, Joe. It will be fun.
No choices.
You're not certainly hoping. It will be fun.
So, I don't see any questions popping up yet. I think, for me, what this work is all about, it's about exploration. As I start with that Carl Jung quote at the start, it's about looking inward. I don't know how many of you are familiar with the Southern writer Walker Percy, but he has a great quote, which is, "The search is what anyone would undertake if he were not sunk in the everydayness of his or her own life. This morning, for example, I felt as if I had come to myself on a strange island. And what does a castaway do? Why, she pokes around the neighborhood and she doesn't miss a trick. To become aware of the possibility of the search is to be onto something. Not to be onto something is to be in despair." So, it's the work that we're looking forward to trying to do. We will be at Feathered Pipe, and I don't know if anyone's ever been out to Helena, but it's a pretty amazing place. They have a pottery, which we're going to try to go to, which is actually where I got this great mug, which you guys have seen on our Monday afternoon coffee hours. And we're going to try to have an experience of maybe doing a little pottery ourselves, taking from the earth and building something that we see and can share and can remember. Or maybe we just buy something from one of the many potters, the artists that are there. We're going to be at Harmony Hill Retreat Center coming up in June. And we're going to do this next month on the 15th of May, something similar to this. Some of us will be back. And I've learned some lessons about trying to manage all these parts today. And hopefully it'll be a little smoother next time for people who had comments. And I promise not to chew ice next time, which apparently was heard. But we are, we want to offer what all our years of experience have brought to you as people who travel with you on your journey. You know, it's I like to think about it, our work as a journey together through illness and disease to optimal wellness. Michael, do you have any last words to share, Courtney?
I will say, won't say last words. That sounds very terminal. I will say launching words is over the next period of time, whether it's today or a week or a month, or if we're honored with your presence at any of our future events. Think about your timeline. Think about the genogram. Don't get stuck in feeling like you have to do it, but ponder it. Use the visualization. I love that breathing in a color, breathing out a color, putting your hand in, pulling out an emotion, examining the emotion, putting it back, let it run around the meadow. Use that visualization, even when you're exercising and stretching. We know that stretching triggers your parasympathetic nervous system. Stretching after you move. Use it if you're having to address some health issues. Imagine how you can launch yourself into greater well-being and a more refined and clear next step and purpose for you. So thank you for joining us this morning. It was enjoyable to be part of this with all of you here on the screen.
Thank you, Michael. Courtney?
I'd also like to remind people too, we've just been through a huge, shift in literally everything that we know. So we're seeing a lot of people struggling with that burnout, people that are just mechanically getting through the day right now. So being able to participate in something like this, where we really have the opportunity to learn some cool tools and, gain some experience and kind of pamper and nurture ourselves in the best way possible. I highly, highly, highly suggest that you guys invest in this yourselves. Invest in yourselves. Even if it's not with us, do it.
Thank you. And so more information about all of this is at josephlambmd.com. There's invites for these upcoming events right now on the Facebook page where you're watching us. We really, really appreciate everyone sharing their morning with us. I want to thank my co-speakers and thank Susan, who wasn't able to be with us but recorded. And thank you all. We're honored. Bye-bye.